Hey guys, welcome to the First Principles of Medicine podcast.
In this series, we will be breaking down complex medical topics into their first principles.
When the stress is on and you've been asked a tough question you don't know the answer to,
we feel you'll be able to fall back on these principles to formulate a decent answer and perhaps reason your way out of trouble.
So, as a patient's coming in, what are the things I should consider if I'm thinking about Cauda Equina?
So, to summarize, Cauda Equina means, in Latin or something,
Yes.
horsetail. And basically, the Cauda Equina is a collection of nerves and nerve roots that branch from the spinal cord at a level of L1 or L2. Cauda Equina syndrome is when you get the compression of these cords, leading to various clinical features that we'll list shortly. But the three most common causes of compression of these cords are disc herniation, malignancy, and trauma.
Cauda Equina presents with typical surgical emergency features, which include saddle anesthesia, bilateral sciatica, and urinary retention plus fecal incontinence. And so when they do come in, first you do an ATE assessment, take a targeted history with their lower back pain with the Socrates method, and do a thorough neurological examination of their lower limb, especially looking for lower motor neuron syndromes. You also want to check for their anal tone, so you do a PR exam, and then you also do a abdominal exam looking for their bladder to see if it's urinary retention, and also do an ultrasound to check if there's any urine in the bladder. And so after I've done all that, do the routine bloods. The gold standard that I want to do for Cauda Equina syndrome would be a urgent lumbosacral spine MRI. So Sim, do you remember what we do for management after we've put it as our top differential? What do we do afterwards?
Surgical package.
Yep.
And you started by keep the patient fasting, nil by mouth, give them IV fluid, or gain the IV access before you do the fluid, pain relief, DVT prophylactic, book the theater.
And what's one thing that the surgical team might consider giving the patient medication-wise?
Steroid, dexamethasone.
Yeah, lovely. Sweet. So I think the three key takeaways that we want from the Cauda Equina syndrome is that it is a triad of urinary retention, bowel incontinence, saddle anesthesia with severe lower back pain and bilateral sciatica. The gold standard for investigation is an urgent lumbosacral MRI, and a urgent surgical review is required for any patient that you suspect of Cauda Equina syndrome. Thank you everyone for tuning in to 1 p.m. At 1 p.m. It's been a pleasure. We'll see you next time. Ciao.